Hi, welcome to my YouTube channel. I am here at Samvid Breast Cancer Clinic with Dr. Shefali Desai. Shefali, welcome to my YouTube channel.
Thank you, Julie.
So, me and Shefali, we will be talking about the awareness of breast cancer and how it is affecting so many women with the statistics. So, I will be asking some questions to Shefali, and she's done so much work. She's created awareness also through charity walk she does every year. So, Shefali, do you want to tell our viewers about how breast cancer has been affecting so many women from around the world?
Yes, Julie, breast cancer is the commonest cancer occurring in women today. It has surpassed cervical cancer, and the cases that we see are increasing by leaps and bounds. In India, also, the number of cases that we see are increasing in number, and the age at which we see these cases is decreasing, which means that younger and younger women are having breast cancer. Initially, we used to encounter women in the 70s and 80s who had breast cancer. Now we see women who are in their late 20s, 30s, and 40s very commonly harbor breast cancer. And today in India, the statistics say that 1 in every 20 women is likely to have breast cancer once in her lifetime.
Scary numbers. And do you want to tell how we can at least create awareness and women around the world can avoid what they are going through?
Yes, Julie, that's a very, very important question. How to increase awareness is a very important question, and we need to increase this awareness because a lot many times we see women coming in an advanced stage, whereas breast cancer is one cancer which is fairly curable if diagnosed in an early stage. So we do not know the cause, but the only key to treatment is early diagnosis. So increasing awareness is mainly by breast self-examination. That is how women examine their own breasts, and they themselves come to the doctor if they have any abnormality, and a routine screening. That is a protocol where we advise that after the age of 30 now, a woman should go and get herself examined by a breast specialist, preferably her breasts. And then what we would advise is sonography till the age of 40. And after the age of 40, mammography and a sonography every 2 years. And after the age of 50, every year a mammogram has to be done. And once this screening protocol is followed, you can diagnose it very, very early.
So, do you want to tell our viewers how they can self examine their breasts?
Yes. So now I have this model of the breast, and the technique of breast self examination is very important. The first thing is when to examine. So the examination should be done after 3 to 4 days after your periods are completed, because the breast is under least hormonal influence, so it is soft. If you examine it premenstrually, there's always some amount of tenderness, nodularity, a little bit of swelling. But after the period, it all goes down because the hormones go down. And if a woman has got a uterus removed, that means hysterectomy has been done, or she's in a menopausal age, then one should pick up first day of every month, or any date, but every month it has to be done. You have to do the examination with the flat of your fingers. Normally, a common mistake which is done is that one lifts up the breast tissue between the finger and the thumb, and then everything is a lumpy and a bumpy feeling, and then there's a false scale. So, what you need to do with the flat of the hand is go all around the breast. Do not miss any part of the breast. You can go circularly all around, or you go vertically or horizontally, the direction that you pick up. You must also examine the armpits, because sometimes what happens is that there's nothing in the breast, but there could be a lump just in the armpit which could have breast cancer. And the second thing is always and always examine for nipple discharge. So squeeze the nipple to check for the nipple discharge. And if there is a bloody discharge, then alarm should ring in your mind. It could harbor cancer.
Dr. Shefali, do you want to tell our viewers that suppose they feel or they are diagnosed with breast cancer, what's the next step?
So once the diagnosis is done with the help of the mammography and the sonography and our clinical examination, and the final stamp, which is done by biopsy, which is usually now done with a needle under sonography guidance. And once it is stamped as cancer, we go for the final treatment. Surgery in early cases is the primary treatment, and now there are women coming up with smaller lumps, early cases, and there are women who are younger, so they want to preserve the breast. So the age-old tradition of treatment was you remove the breast for if it was diagnosed with breast cancer. But now the surgical techniques have advanced, and what we do is just remove the lump, a tissue around it, confirm that everything is removed,
Right.
and so we preserve the breast. Because breast is a very, very important organ for a woman. It's a symbol of beauty, motherhood, womanhood, and I think sensuality also. So breast preservation is a very important development and an advancement, and the dignity of the woman is preserved.
Right. And how do they implant or how do they retain the look of the breast as you talked about it?
So once breast is preserved, we just need to do some cosmetic surgery with some rotational flaps. But there are certain women who still want to remove the breast. They have a taboo that there is a chance of recurrence. So they want to remove the breast, and in or maybe larger lumps, we still prefer to remove the breast. So then what we offer them is reconstruction, because nobody wants to be flat chested.
Right.
So the reconstruction could be done in different ways. The most important being with implant. Silicone implant is what we use. I'll just show you a sample of the silicone implant that we use. This is the kind of silicone implant that we use. It's a very soft implant. It remains in the breast area where we have removed. We cover it with some local muscles. So there are some women who don't want any foreign body as an implant in their body. So what we can do is take the abdominal fat and muscle, and we can put them in the place of the breast. So sometimes we always advise women who have a big fat tummy that they have to reduce. But this is one time when this fat can be used to reconstruct the breast.
Yes. So suppose you find a lump in your breast, and obviously there are some lumps which are not cancerous, they are benign. So then how do you go about it?
Yes, Julie. Yes, Julie. I think again that's a very, very important point that you have come up with, because once a woman feels the lump in the breast, she always feels that it is cancerous. But 60 to 70% are non-cancerous. That is the good part. And if it turns out to be benign with again our mammography, sonography, and the biopsy, we have something called minimally invasive surgery. If a patient comes up with say bloody nipple discharge, then we put an endoscope like at other places, and then we diagnose, and endoscopically guided, we just make a small incision and remove only just that part. So that is one thing. And if there are lumps which are small and non-cancerous, we have a special device called the vacuum assisted biopsy system, where we just suck out the lump under sonography guidance without any major incision. It is a very small puncture, again, which is cosmetically very important. So these are the newer developments in breast lump treatment.
Perfect. So at Samved Breast Cancer Clinic, Dr. Shefali and the group of other doctors has been advocating around town how they raise the awareness for the breast cancer awareness. So that is something I would like you to talk about, Dr. Shefali.
So my aim and motto is to spread more and more awareness in each and every woman around us, because still we get a lot of cases which are advanced, because women by and large tend to neglect their health problems, and when it comes to lump being painless, they come very late, only when they have a very huge sized lump. So if, as I said, that we diagnose it early, we can cure the breast cancer. And to spread this awareness, every year we have a walkathon and a cyclothon, where there are two parts about it. That we have a fun-filled event where there is a walk and a cycling event, but the second part is where we felicitate our breast cancer patients, and they themselves come on the stage. They talk about their life stories and they motivate everyone what they have gone through this when in their life stories, and they would definitely advise rather than just us advising that if they can stand on the stage after maybe 6 months or 1 year of treatment, then anyone can do it. So even if you have breast cancer, there is nothing to worry about it. Breast cancer is so rampant and there is no discretion. You and I, anybody could have breast cancer. So I want to actually reach, I think, not only the urban areas but even the rural areas, because there the women are totally unaware and their priorities are definitely not taking care of their own health.
Dr. Shefali, do you want to tell our viewers how you're reaching out to the rural workers?
We have our breast clinic at the Health and Care, which was the older Polio Foundation, where there are health workers which go to the rural areas, different areas. They gather the women along with the local health workers, and they have some awareness talks over it. We also have special mobile screening units with which those health workers screen those women, and if there is any doubtful cases, then they get them to our center and we examine them, kind of do a mammography and a sonography, and if required, we also do biopsies. We do a free job for them so that at least they are motivated for treatment.
So, what are the challenges these health workers at the rural area are facing?
That again is a very, very interesting question, Julie. The women, as I previously also said, that the priority, especially for the rural women, is not their health. If they kind of have some, I would say, bhajans or some social meetings, they would rather go there, and we would have our talks arranged over there, and then we literally have to pull them out to hear what we are saying and get themselves checked up, because they don't want to get their breast checked up or they don't want to have a gynec checkup because of their social inhibitions or mental blocks. So that is a big challenge. I think this is something, since this month I have been talking about women's health from around the world to these amazing women. Dr. Shefali is one such amazing woman which I am interviewing today, and I feel honored and privileged to be here at Samved Breast Cancer Clinic. Dr. Shefali, thank you so much for giving this interview and taking out time, even though the busy schedule. The pleasure was entirely mine, Julie, and you are doing great work by spreading this health awareness, which is part of our motto. So I am very grateful to you that through you I'll be able to spread some awareness. So I think this is breast cancer awareness is something which is very important to all women and women from around the world. So Dr. Shefali has this amazing website which has a ton of information, which will be as part of the description. I'll be listing out the website. So if you want to know more about breast cancer awareness or more about what is breast cancer, please go through the website. So if you're watching this channel for the first time, do subscribe to my channel. We have amazing women like Shefali on this platform on a regular basis. Thank you so much.